Seema Gupta has this update from Rome.
3,405 deaths with the coronavirus infection in a country of 60 million. The figure is smaller for China, a country that has a population of some 1.5 billion people. So really, the authorities are saying that this is because of Italy's overwhelming elderly population, the second oldest population in the world. The bulk of the cases of those who have succumbed to the disease are those over the age of 70. On top of that, you have the fact that maybe the health system is just overwhelmed by these cases. We've seen medical personnel get infected. More than 2,600 of them are infected, and at least 10 doctors have succumbed to the disease. And then on top of that, perhaps the lockdown, particularly in Lombardy, where we're seeing the large number of infections and the deaths, that lockdown perhaps should have come earlier. At the moment, though, the authorities are just working hard to try and contain and limit the spread, which is why the message is very clear to Italians to stay at home. The Prime Minister is saying, look, there are just too many people out and about without a good enough reason. These measures that they've put in place perhaps are not enough. They're talking about banning all kinds of outdoor activity. You can't even be going for a jog. This should not happen anymore. On top of that, they're saying that there's probably going to be an extension on the school closures. And as far as supermarkets are concerned, they're looking at the possibility of staggering their openings or staggering the amount of people that they can go in and the hours that they can go in. So there has been some concern here in Rome. We saw initially some lines form outside the supermarkets as people was concerned about their access to goods, even though the government has assured that food supply will always remain. All that said, though, 53,000 violations of the lockdown in the past 8 days. The authorities believe that this is too much. Patrols have definitely increased, and they're hoping that the message of stay at home, simply stay at home, has to stick in order to limit the spread.
Here in France, the outbreak has mostly been concentrated in the east of the country, and hospitals in the area are overwhelmed. This as medical facilities elsewhere in France are rushing to prepare for an influx of patients. Monty Francis has the story.
Two vast extremes within the French border. Hospitals in France's eastern department of Upper Rhine are so overwhelmed by cases of COVID-19, some critical patients are being evacuated to hospitals in other parts of the country, where cases of the virus are not spiraling out of control. But a hospital in Poitiers, a city in western France, has almost 100 vacant rooms. It also has the capacity for about 40 patients to be on ventilators.
On va commencer à prendre les premières vagues de patients. On compte sur fin de semaine ou début de semaine prochaine avec un week-end qui va être un peu agité.
Il est là, ça fait depuis ce matin qu'il n'arrive pas à respirer, le patient.
In the meantime, medical teams are training to intubate patients with COVID-19.
Le patient est intubé.
And they're practicing with a lot of protective gear.
Ils ont chaud, ils sont limités dans leurs mouvements, ils n'arrivent pas à voir correctement à cause des lunettes de protection.
At SAMU, France's emergency medical services, calls about the virus have doubled in recent days. Just 6 doctors are working the phone lines, providing answers to a worried public.
On peut solliciter d'autres médecins, des médecins qui ont déjà travaillé dans le centre 15 qui sont à la retraite. On peut solliciter des étudiants en médecine qui sont également en formation à l'université.
Hoping that a nationwide confinement slows the spread of the virus, hospitals in France are preparing for the worst-case scenario.
Well, people have been told not to leave the house in France, except for essential trips. But many homeless people don't have this option. Without access to shelter or proper hygiene facilities, people living on the streets are particularly at risk from the virus. And many will need additional support to survive the crisis. James Wilson reports.
For those who live on the street, self-isolation is almost impossible. At the Salvation Army Centre in Paris, volunteers take precautions against the virus. But for the homeless, the disease has complicated an already difficult existence.
Vous ne pouvez pas aller vous abriter dans les bibliothèques, vous pouvez aller nulle part, c'est que la rue. Et après, quand vous passez devant la police, bonjour, vous allez où? Bah, je vais chez moi, où ça? Dans la rue, voilà.
This centre is busier than ever, but all food is now made to go in order to reduce the risk of contagion. But keeping a safe distance is impossible at this refugee camp in the north of Paris. It's home to some 400 immigrants, and sanitary conditions are dire. This young man has been living here for a month and freely admits he's worried